Hello, we are here with Reba from Silver Snout Rescue in Indianapolis, Indiana, and Dr. Darby here at Ebron Animal Hospital. And today we're going to talk about cancer in canines. So, Dr. Darby, what are some common types of cancer in dogs?
Yeah, so there's a lot of different types of cancers in dogs, but the most common type that we see are like skin tumors, which can be like mast cell tumors, melanomas, sarcomas. But then we can also see tumors of the different reproductive organs. Like in Reba's case, she has a mammary type of cancer. Hers isn't confirmed to be carcinoma, but that is the most common type. And then otherwise, we see a lot of bony cancers like osteosarcoma.
Then, what are some signs and symptoms of dog cancer?
One of the biggest signs and symptoms of cancers in dogs is like a tumor that you can sometimes see, and sometimes it's internal, especially if it's rapidly growing, or if you have unexpected weight loss. And the last thing is if you notice your pet is drinking an excessive amount of water, that's another clear sign.
Why is early detection and diagnosis of cancer in canines so important for these guys?
The earlier we detect the cancers, the more chance that we can intervene and potentially lengthen the lifespan of your pet, or even get them to the point where they're in remission that we can see from these guys.
How will a veterinarian like yourself diagnose cancer in a dog?
It depends on the location. A lot of times what we're looking for is if it's a tumor on the skin, we can do what we call a biopsy, which is either with a needle or sometimes we'll actually remove the mass and send it off under anesthesia. If it's something that's more internal, we'll have to do more diagnostics with x-rays or ultrasound to see where it's at and if it's something that could be a surgical case.
So, what are some treatment options that are available for dogs with cancer?
So it depends on the type of cancer. Surgical removal is the number one treatment option for most types of cancers, and it has the best prognosis. The other things is sometimes we can consider chemotherapy, which always scares a lot of owners. But with chemotherapy with dogs, we're not going at such high dosages as you see with humans, and so a lot of times you don't see as many side effects.
And with that, what are some side effects caused by cancer treatments?
So some of the cancer treatments, especially chemotherapy, you can start to see that they're an increased risk for infection, appetite changes. You can also start to see them have any sort of changes with their hair coat. Not as common as it is in people, but every once in a while we'll see that. And rarely they can get a really low neutrophils, which are really important for the immune system. So those are the biggest things we see with cancer treatments.
You said that tumors can be removed by surgery. Are there any kind of tumors that cannot be removed?
Depending on the location, if they are too large to remove safely and still be able to close the tissue around it, that's a big consideration. Another thing is if there's really important tissue next to it. So if it's internal and there's important stomach next to it, or there's important blood vessels, that'll limit our ability to remove the tumor.
Earlier, you said something about radiation, chemo treatment, whatnot, for advancements in treatment of dog cancer. Are there anything new things coming out on the horizon for dogs to help them?
There's 2 or 3 new things that are coming out. One of them is a new type of radiation where they're able to really locate the radiation to a specific spot. It's called stereotactic radiation. Depending on what kind of tumor is there, if it's one that's maybe not a surgical case, it might be an option for your pet. Another type of treatment option is they're coming out with vaccines for certain skin tumors like sarcomas, melanomas, mast cell tumors.
And what should I know about end-of-life care in case the cancer is not treatable?
If the cancer is not treatable, and if some of these diagnostic options are not an option for your pet or your family, I always say talk to your veterinarian about quality of life signs and things that we can do to keep your pets comfortable and happy during their final days.
Thank you, Dr. Darby, and thank you, Reba, for this wonderful presentation talking about doggy cancer.